All right, so the next few sections are going to be about some complications of pregnancy. First of all is miscarriage. One thing that you need to know is the medical term for miscarriage is abortion. It's distinguished by either spontaneous abortion or induced abortion, but we don't use the term abortion with patients or families because it's very emotionally charged and it's connected with induced termination of pregnancy. So we typically use miscarriage. Any pregnancy loss before 20 weeks is considered an abortion or miscarriage. Spotting and light bleeding is not uncommon in early pregnancy. Most people who have some spotting go on to carry full term. A threatened abortion is bleeding before 20 weeks. And like I said, the majority of those people go on to carry to term. The management for that is just observation. An inevitable abortion, the cervix is open. That means the pregnancy is not viable. So the provider may either choose to observe and make sure they pass all the products of conception or do a D&C. If one thing to be aware of is that if they don't pass all the products of conception, in a reasonable time frame, a few days time, then there's a risk of infection. That would be a missed abortion or missed miscarriage. The embryo or fetus has died before 20 weeks, but it has not been passed. And there's some room to wait it out for a couple of days, but also I've seen a patient who was near septic because providers kept sending her home to miscarry naturally. So there's at some point intervention needs to be done. Usually that would be a D&C as long as it's first trimester. Later, if it's later in that first 20 weeks, they might have to do a dilation and evacuation because it may be too large for D&C. An incomplete abortion, some of the products of conception have been expelled, but not all. The products of conception include the embryo or fetus, the placenta, and the membranes. And again, some providers might observe to see if they go on and complete passing that, and some might do a D&C. A complete abortion or complete miscarriage, the pregnancy has been completely expelled. The risks are excessive bleeding, infection. They can also miscarry one of a multiple pregnancy, and sometimes if the provider is going to do a D&C, sometimes there's a risk that they could actually disrupt a pregnancy that's still stable. So they need to be assessing whether it was one of a multiple. An ectopic pregnancy is when the pregnancy implants somewhere outside of the uterus. It is not a viable pregnancy. Yes, I'm aware that there have been a very, very few noteworthy cases in which a pregnancy that implanted somewhere outside the uterus did survive long enough to be viable. Most commonly, that would be on the liver, and it is incredibly, incredibly high risk. That patient would be risking their life. The most common place for ectopic pregnancies is in the fallopian tube. And what will happen if a pregnancy implants in the fallopian tube? Either the pregnancy will fail, the embryo will die, and then eventually reabsorb, or as it grows, it can rupture the fallopian tube, which would causes damage and scarring to the tube, but can cause shock as well. It can cause hemorrhage and shock. The longer, the later that pregnancy is allowed to progress in the fallopian tube, the higher the risk of hemorrhage, and the higher, the more severe the damage is to the tube. The symptoms, this will be colicky or stabbing pain, usually located on one side, vaginal bleeding. That's not going to be heavy bleeding. Usually it might be some spotting, and sometimes it may be brownish. Nausea, vomiting, diarrhea, weakness, dizziness, fainting. The HCG level, serum HCG, may be lower than expected for gestational age. So the embryo may die and be reabsorbed. It may die and the products of conception become a site for infection or be walled off as a cyst, or it may continue to grow and rupture the tube, which causes shock. Management of this, if it's early enough, methotrexate can be given. Methotrexate is actually a chemo drug. It stops the cell division in rapidly dividing cells, which would include an embryo. It causes cell division to stop, and that leads to the death and reabsorption of the embryo. If it's too advanced for methotrexate, or if the tube is ruptured, then it needs to be surgically removed. Sometimes they're able to salvage the tube, but if that's the case, there's an increased risk of tubal implantation in the future. There's ectopic pregnancy has been in the news recently, with some states proposing legislation to make ending an ectopic pregnancy illegal. That is poorly informed and dangerous. Whatever your views on abortion, ectopic pregnancy is not a viable pregnancy and is dangerous to the pregnant person. The next section, we're going to talk about gestational diabetes.